What is rheumatology? In very simple terms, what is rheumatology?
Yeah, I'll go to the scientific definition first as much as possible. Then I'll try to be as simple as I can manage to be. Yeah, because rheumatology just refers to that branch of internal medicine that measures in the study and diagnosis and management or treatment of rheumatic diseases. Yeah, so it is the branch of internal medicine because first there is internal medicine, then rheumatology. So you have to be an internal medicine expert first, then you become a rheumatologist. And rheumatology is that branch which measures in the study and diagnosis and management or treatment of rheumatic diseases. Yeah.
So when you talk about rheumatic diseases, what do you mean? What are rheumatic diseases?
When we go to the definition of rheumatic diseases, what are rheumatic diseases? Now, rheumatic diseases are chronic, mostly chronic diseases which will last in the body for a long time, most of them even lifelong for the rest of somebody's life from the time of diagnosis. So they are long-lasting, call them chronic, inflammatory, systemic, autoimmune. Those are now terminologies which will try to bring down disorders of the skin, the joints, the muscles, the blood vessels, the tendons, the ligaments. There are some other areas in the body called bursa. Okay, all those are involved in these diseases, and then these diseases also involve internal organs.
So Doc, why did you start this clinic, the rheumatology clinic? What was the reason behind you starting this clinic?
So comprehensive rheumatology clinic was started to deal with the majorly rheumatic diseases. But because it is a branch of internal medicine, we also deal with internal medicine because I'm also an internal medicine expert. Yeah.
So when you talk about rheumatic diseases, which organs are primarily affected in one's body?
Any internal organ can be involved in these diseases because they are autoimmune. Autoimmune means that the body is forming kind of some weapons to attack its own cells. So some of those weapons can be antibodies or some other cells which now specializes in attacking. They are supposed to attack diseases to protect the body against diseases, but now they turn around and start attacking the body's cells itself. Okay, so when that happens, because cells and cell nuclei are found in every single part of the body, it means that rheumatic diseases can attack any organ and system in the body, ranging from the kidneys, the lungs, and the covering of the lungs, the heart itself and its coverings, the eyes, the brain, name it. These autoimmune disorders can attack any organ or system in the body.
So Doc, what are the other effects of the disease on our bodies?
Also, rheumatology deals with what we call mechanical or the degenerative conditions of the body. So there's the inflammatory part of it, autoimmune, and then there's the mechanical part of it, degenerative. So you'll find it like, for example, diseases of the joints. There are some diseases of the joints which are degenerative and others are inflammatory. So even the degenerative ones, the mechanical ones, are also included. And then there are also pains which occur in various parts of the body. So you can have regional pain. Regional means it is in various parts of the body. But also you can have pain which is chronic and widespread. Now this one covers almost, it's spread all over the body. So it also deals with pain, management of those painful conditions, which are either regional or chronic and widespread in various parts of the body.
So I can see you've called your clinic Comprehensive Rheumatology Clinic. So why the term comprehensive?
Now the term comprehensive here is because rheumatic diseases will attack any organ system in the body. You need a management of the disease in a kind of like collaborative manner. So that, say, if it attacks the kidney, we'll manage you in collaboration with a kidney expert. If it attacks the eye, we'll manage you in collaboration with an eye expert. If it attacks the lungs, we manage you in collaboration with a lung expert, so that we give you the best management. But also comprehensive means that the management is holistic, because we don't treat you like an object which is sick. The chronic diseases, they have a lot of psychological and mental impacts on the patients. So it needs to be explained to them very well to allay their anxieties. There are also disabling disorders, so that a patient who is attacked by these diseases may find that they cannot perform some of the tasks they used to perform. So one needs to take time with them, even as you are taking the history. In the first instance, when you meet them, you have to find out what can you do now, which you would, what can't you do now, which you are able to do before, how has this thing affected you, and all that. And so we'll also be able to take care of that. Rehabilitation, physical therapy. So comprehensive means covering every aspect of the how the disease involvement with the patient.
Now, does it mean that any bodily pain is a sign of rheumatic disease?
Not exactly. Not exactly. There are some pains in the body which will it's a difficult question to answer, because if a patient has, say, a painful condition in the chest, that patient initially may not come to the rheumatologist, may not, but it may be rheumatological. Many times when the patients move around, because a patient finds he has a painful condition, maybe in the chest, then they go to see a doctor of their choice, who they always see. Because most people, like in our environment, Kenya, East Africa, Africa itself, there are not very many rheumatologists. So linking a pain with the rheumatologist, you have to know, first of all, that something like rheumatology exists, and there are some rheumatologists around. People normally think about what they have some idea about. So if you have a chest pain, depending on why it is, some people will look educated will think about their heart, say if it is around there. But they may not think that the heart can be attacked by a rheumatic disease. So they'll go to the hospital, to the doctor they know, very concerned that the doctor, I'm having a chest pain on the left side of my heart, or of my chest. Could I be having a heart attack? Then sometimes they end up running all tests to do with the cardiology, and they are negative.
So in our setting, why would you say that most people know about malaria, typhoid, and less about the rheumatic diseases?
Now, in the first instance, those diseases you are talking about, they were known in the society for a long time. In our case, even when I was an undergraduate, we were introduced to rheumatology by a rheumatologist from Uganda. He was called Dr. Wankia. Yeah. Then that one was when we were in third year undergraduate medicine. Then after that, there was no rheumatologist because Dr. Wankia went back to Uganda shortly thereafter, less than 1 year thereafter. And unfortunately, I think those times of Idi Amin, he was one of the people who was killed there. Yes, those are the pioneers of rheumatology. They were in Uganda, West Africa. There was nobody from Kenya. So most of the doctors who trained in the early days were not so much into rheumatology. And so you'll find the first doctors to specialize in rheumatology were much, much later, and then you are few. So if the doctors themselves, they are very few, because by the time I was training as a rheumatologist, we were only 2 active rheumatologists in the country, all over the country. So you can imagine, and we are all in Nairobi at Kenyatta Hospital. So getting somebody in the remote parts of the country to know about rheumatology was almost impossible. And then now, the problem also is that you can present to a clinician with things which may eventually turn out to be rheumatic conditions. But the majority of clinicians tend to manage these diseases symptomatically when they have investigated, because you investigate according to what you think. So when they have done their own investigations and they have found their investigations are negative, then they start symptomatic treatment instead of referring the patient to be investigated for rheumatological condition. There are a few who refer, but the majority don't. So that one keeps the population unaware of the existence of these diseases.